The second wave of COVID-19 pandemic continues to stay strong in India. The second wave of COVID-19 is spreading faster than ever, with 20.65 lakh cases registered in the first half of April itself. While in some way the virus is still the same, yet it's quite different in terms of symptoms, age profile and spatial distribution. The very first difference between the first wave of virus and now is that it is affecting the younger population more. Arvind Kejriwal recently said more than 65% of COVID-19 patients in Delhi, which is one of the worst affected places, are below 45 years of age. Similar reports have come from Maharashtra and Karnataka as well. The reports say that nearly 50% of the infection is below the age of 45. But elderly are still under risk. However, since most of the elder population have been immunized, they are safer than they were in the first wave. The government data earlier this month showed that about 80,000 children tested positive for COVID-19 in the 5 worst affected states, Maharashtra, Chhattisgarh, Uttar Pradesh, Karnataka and Delhi, from March 1st to April 4th. Since then, doctors have said that more children are increasingly tested positive for COVID-19. In the first wave of coronavirus, kids were asked to stay at home. Schools were shut, but as the numbers went down between December 2020 to February 2021, schools reopened. Kids who were secured inside their houses were exposed to the virus. Moreover, children below the age of 1 to 5 are also getting infected now. As the number of cases are rising in the country, several hospitals have reported a sharp rise in the number of children between the age of 1 to 5 being admitted in the hospital. Calling the situation very dangerous, pediatricians have asserted that the virus is taking a toll on the newborn and the youth. As per the reports, the number of children getting admitted to the hospital has increased 5 times as compared to 2020. Unlike last year, the virus is affecting infants, with some as young as 1.5 months old getting admitted to the hospital. Now let's talk about symptoms. Shortness of breath is still one of the most common symptoms of coronavirus, as it was in the first wave. In the first wave, 41% of the patients complained about shortness of breath, and in the second wave, 47% of the patients are complaining about the same. Hence, the oxygen is on high demand. In the first wave, only 41% of the patients being admitted in the hospital required oxygen. But in the second wave, 54% patients required supplemental oxygen. So more than half the patients admitted are using oxygen now. Apart from common symptoms like fever, chills, body ache, loss of smell and taste and loss of breath or respiratory complication, this wave has come with some new symptoms which were unheard of in the first one, like pink eyes, loose motion or hearing impairment. Now, in terms of areas affected, the first wave of COVID-19 was more widespread in geographical reach, with hotspots spread all over the country. The second wave is more infectious but has been limited to fewer hotspots. While over 40 districts reported 50% of all COVID-19 cases in India in the first wave, only 20 states are currently reporting half the coronavirus infections. At its peak in the first wave in August-September 2020, COVID-19 pandemic saw 60 to 100 districts reporting 75% of the cases in India. But this time, only 20 to 40 districts are reporting 75% of all cases in the second wave. There is no change in the death rate between the first and the second wave of COVID. However, the number of deaths that the government report shows differ from the data crematoriums have, which raises question if the data of death counts in the country is in fact reliable. This time, India has its own Desi mutated version of the virus. Now, whether this new strain is resulting in the huge spike in coronavirus cases in the country is still a big question. This variant, classified as B.1.617, has been found in 8 nations, with 70% of samples comprising mutations believed to have stemmed from India. This mutated virus could also be the reason behind the fake negative RT-PCR results, but the government has said that RT-PCR test is capable of detecting all the mutants of the virus. So is one mask not enough? In the first wave of coronavirus, one mask and few drops of sanitizers were enough. But now the experts say that if you are in public place, you should wear 2 masks. Double masking is another thing that has emerged in the second wave of virus to keep ourselves double secured. Since last year, several studies have found that coronavirus SARS-CoV-2 spreads mainly through air. Yet there have been other studies, including one funded by World Health Organization, that have found that evidence inconclusive. However, another research was done which concluded that the primary transmission route for SARS-CoV-2 is indeed airborne. Although the government of India is making moves to control the situation, India has decided to allow foreign vaccines in India. It is also importing oxygen cylinders to fulfill the demand of supplementary oxygen in hospitals. Government has also announced that the vaccination will be open to all above 18 from May 1st.